So if you're suffering from type 2 diabetes or insulin resistance, it is important to understand how one develops type 2 diabetes and insulin resistance, because the way in is the way out. So before I talk about this, I want you to understand the glucose stores in our body. So the carbohydrates that you ingest are broken down into glucose. How fast the glucose builds in the bloodstream depends on the carbohydrates you eat. So let us say you eat carbohydrates with high fiber. Then it'll take time. The classic example would be quinoa or a bulgur wheat. But let us say if you eat simple carbohydrates like processed carbs, like too much of chocolate or donuts, or sometimes even white pasta or white rice, the glucose quickly enters the bloodstream. The hormone insulin will put the glucose into 3 storage areas. The one is called as the muscle glycogen, the other is called as the liver glycogen, and the last one is fat. Let's see how a person actually develops type 2 diabetes. So in type 2 diabetes, there is actually insulin resistance. So I'm going to run through a scenario just to have a better understanding of this concept. So let us say I drink milkshake which is loaded with sugar. Once I drink that, my blood sugar starts spiking. My body immediately senses that and it starts producing insulin. The goal here is that it wants to make sure that the blood sugar doesn't spike more than 140. Unfortunately, our body doesn't exactly know how much insulin it needs to produce. All it does is that it wants to make sure that the blood sugar doesn't spike more than 140. So there's a big push of insulin that happens in your body. So the insulin tries to bring the blood sugar down, and sometimes it overshoots the insulin secretion that causes the blood sugar to drop down. And then immediately our stress hormones, predominantly our cortisol, and the other hormone that we talked about is the glucagon, they start to again elevate your blood sugar to back into the range, that is the 70 to 140. So when this happens, our body starts to understand something, right? So now our body starts to create resistance to insulin. Why is that? So think about this. Let's say if someone slaps you, and obviously you feel the pain, right? But let's say if that person is going to slap you every hour, right? After a few days, it's probably not going to hurt you like it was hurting you the first time when you got a slap. So what happens is that you start to create resistance for the pain so you don't feel it. So that's what every smart person will do, and that's what happens in our body too. So now our body says that, you know what, so he's probably eating too much sugar, I don't want my blood sugar to drop quickly, so I'm going to create some insulin resistance. So this way, when the next time when he eats something, even though if I produce too much of insulin, there is a little bit of resistance to insulin, thereby not too much of insulin acts right away to get the blood sugar back into control. But imagine you keep doing this every day. You keep drinking chocolate milkshake every day. You keep eating high sugary foods. And then eventually your body starts developing insulin resistance to the point where you start needing more and more insulin. Okay, so that's one scenario. The other scenario is that we talked about how when you eat excess amount of glucose that is not being used for energy, the excess glucose gets stored in the liver, muscle, and fat tissue. But again, these are all stores in your body. I mean, after these stores are full, the excess glucose cannot get stored in the storage areas. Initially, what happens is that, so let's say the glucose goes to the storage area and it kind of knocks the door and says, you know what, I want to come in. And then the storage area, such as the liver glycogen and muscle glycogen, says that, you know what, we are full, just go back. What does the glucose do is that they go and complain to the organ pancreas where the insulin is being produced, and the insulin comes and then they basically force the glucose into the storage areas. Eventually, what happens is that these storage areas starts to put more and more barricade, or like more and more gates, and then it starts to become more and more harder to push these glucose into those storage areas. So there's a point where the organ pancreas is unable to overcome the resistance created by the storage areas. Then you start to develop increased blood sugar, and that's when you start developing type 2 diabetes. So when you analyze closely, you'll find that the patient has high blood glucose, but they also have high insulin levels. But let's say if you take a type 1 diabetes, they have high blood glucose, and but they don't have enough insulin. So then this patient comes to the doctor and says, you know what, my blood sugar is high, and then we started prescribe medications. Not all medications actually increase the insulin levels, but certain medications do, and this actually worsens the insulin resistance. And after that, once things go out of control, then we prescribe insulin, which actually worsens more insulin resistance. But we know clearly that high insulin levels can be bad for your body. I hope this video was helpful. I'll see you in my next video. Until then, goodbye.